Today's my topic will be on the bones or the bone we are going to deal. So in this one important thing you have to remember, there are many tissues in our body. So we are going to have the different tissues, classification of tissue. We have the cell, we have the tissue, organs, systems. All these are there in the total in our human body. So one tissue which is called specialized connective tissue we call. It is a one which is a specialized connective tissue which is composed of 1/3 of the connective tissue. Then it is composing remaining thing is by the calcium salts, inorganic calcium salts. So that this will become a very hard and rigid structure, and that we are going to call as a bone. So bone is a specialized connective tissue composed of connective tissue 1/3 and inorganic tissues or the salts which are we are going to get like a calcium phosphate and calcium carbonate and other traces of other elements also there. So you have to remember only calcium carbonate, calcium phosphate, majority are there, but we may get the some traces of other elements, and that will making the hard and rigid structure, and that we call as a bone. So you have to identify when you define the blood. Blood is a fluid connective tissue. Simple word. When you are going to get the fluid connective tissue is blood. So specialized connective tissue is a bone. So other connective tissue classification you are going to study in the histology. Under that you are going to give the examples of the different connective tissue. So that is very important to know about these things. When after the definition you have to know about what is the classification of bones. We classify the bones into a different 4 broad classification. So broad classification, how they are going to divide it? They are divided according to the shape, how they look appears. Then developmental, according to the development, how the development process of the bone is started. According to that one group we can make. Then according to the location of the bone, that we call as one which is according to the area or the region where the bones are situated. Like you have axial skeleton and appendicular skeleton, that will be included in the bone also. Lastly, we have the structural classification. So 4 broad classifications you have to remember in this. One which is you have the according to the shape, how their appearance. Is it long bone, short bone, flat bone, irregular bone, nematic bone, sesamoid bone? All they are there in this according to the shape. Then going to the developmental, when we go, the process of development of bone is called as ossification. So word whenever I use the ossification, you have to must remember whatever you are going to tell about that is the process of development of bone. So one thing you have to remember in this, these 4 categories are very important, and you have to remember about all the things which is you should know, and according to that you have to remember about the developmental, how the process of formation of bone is taking place. That we include in the developmental. Then comes about the region. I have told the regional classification which is we get, that is where the body part, these bones, where they are located in the body. According to the region, according to the location, we can call. Then structural. Structural means when you cut it, what naked eye we are going to see. How appearance of the bone is there. Then you have to next you have to keep that section of the bone under the microscope. We can divide the macroscopic and microscopic. So that we include in the structural. Very important to understand these all 4 categories, and with this you are going to explain each one what it means, then what are the examples of this you have to explain. That we include in the That is a classification of bone. When you go to the classification, I have told already according to the shape and all, when you go, this is the first category where we can get as a according to the shape. I have told long bone, short bone, irregular, flat bone, then limitic bone, sesamoid bone, accessory bone. All these will be included in the according to the shape. When you go to the long bones, you have the length is more. Whichever bone when you take, you are going to call as a long bone. It is the length is increased more. Then those bones we call as in a longer. We are going to get then the width. Width is less. Longer we are going to get the height. So those we call as in a long bones. But long bone should have the. It is having the shaft, and it should have the two ends, upper end, lower end, or the proximal distal end, or it has a total shaft. So this is the one which is you get, and here examples you are going to get the most of the body, upper limb, lower limb bones are the long bones. You can go from the femur, then with tibia, fibula, humerus, radius, ulna. These are the maximum thing which is you have to remember in the total examples of the long bone. Short bone, roughly they are the cuboidal. Means they are having the 6 surface, 4 surfaces which appear like a cube, and those we include as a like that is a we get the short bone. They are the carpal bones and tarsal bones. Carpal bones we have in the hand, tarsal bones we are going to have in the total in the foot region. So we have 8 carpal bones and 7 tarsal bones which are you are going to get, and that you have to remember. Okay. So examples of the short bone will be the tarsal and carpal bones. Next we get the flat bones. These flat bones we are going to get like in the skull. Ribs we have, sternum we have, even scapula. Scapula, ribs, sternum, skull bones, all these will be there in the, that is a flat bone. Irregular type of bone, you have the vertebrae and hip bone. There is no definite shape. There is no either in the long, either in the short, either in the flat. Then there is no definite shape. They are having the different in appearance. So that condition we call as an irregular bone. So those you are going to get as a one of the thing example, that is the vertebrae, and we have the hip bone also irregular one. Okay. Sesamoid bone, very important. This is a separate topic I am going to deal. But first you have to understand, developed in the tendons or tendons. Example is patella. Largest sesamoid bone in the body is the patella. Then what is the meaning of sesamoid? Sesamoid is nothing but it is a one which is a bony nodules which are developed in the tendons of the muscle. We are going to get whatever these bones are found only in the tendons of the muscle. Sesame means they are the seed-like. That is the Arabic word which is a sesame. Sesame we call. That means we call as these are the bony small nodules, and they are developed in the tendons of the muscle. Very important. And this we have the largest sesamoid bone, that is the patella. One more bone in the hand, pisiform bone, as we studied the carpal bones. Pisiform also is the one of the example for the sesamoid. Nematic bone, this word itself gives you the idea. Ne means air. Air. Some bones are having the air-filled spaces. Because you can understand these all, according to the name you can understand. But you have to remember the nematic is which one which you are going to get. There are the air-filled spaces in the bones. Means what? Air is present inside the bone. No? Bone marrow is there inside the bone. So that some bones we have, that is air-filled spaces, and those lined by the epithelium, and having the space which is filled by the air. Ne means air, and these bones we call as a nematic bone. So what you have to remember here? So you have to remember air-filled spaces in the bones lined by the epithelium, and they are bones which are present near and around the nasal cavity. Near and around the nasal cavity, like we have frontal, we have maxillary bone, sphenoidal bone, ethmoidal bone. So all these will be there in the near around the nasal cavity. So those we include as a nemetic bone. And why they are present only on the near and around the nasal bone or skull? They are making skull lighter. If your skull become more heavier, if it is filled with the bone marrow and thick solid connective tissue like a bone, then you have to remember about they making the increased weight of the skull. So whatever the body structure is made according to the nature, this is a God gift. They are not made a heavy skull. Already brain is we are going to get that is a 1.5 kg brain. So that in that again skull is 1 kg means always you have to bend forward or backward only. You cannot straight up. So that which is nemetization we call nemetization. It is the one which is makes the skull lighter, and then it is adding the resonance to the voice. Means what? Whatever we talk, all this resonance is added to the voice by these all nemetic bone. That we call as a nemetization. Okay? And also they are making the lighter more economic, and they are adding the resonance to the voice. Whenever you get the bad cold, now everyone is suffering from bad cold and cough, flu. That time they are affecting these bones, sinuses, so that they change the voice. You get the change in the voice as if we are talking in the nose or whatever, like. So that is all because of the affecting the nemetic bone. In this we have maxilla, sphenoid bone, frontal bone, and ethmoid. Very important. These examples, they are present near and around the nose. So that is the one which is you can. Next category comes about the second broad classification, developmental classification. I am told one day not all these bones are developed. So one bone which is not all 206 bone, one day it is developed. So whatever all this development is process is different. So developmental process starts from the before birth to the after birth. Till 20 years of age you are going to get still bones like a sternum and all, they are ossifying in the 25 years. So this process is starting from the beginning where the body structures are developing in embryo. So that membranous type of bone, I have told the ossification is the process of formation of complete bone. That is the ossification. Then in this you will get the membranous, two types, membranous and cartilaginous. And in this all skull bones which are there, they are very soft in appearance, membranous. So all these developmental process occurs in the skull bones. They develop always in the form of membranous type of type of bones. Then cartilaginous, you know what is a cartilage? It is a tough, resilient connective tissue which is having the gel-like matrix inside, and it is soft-like, easily cuttable. Bone is not easily cuttable because of the calcium present. If you remove from the bone calcium, then whatever the soft, bending, easily cuttable, easily resilient we call, such type of we call as a tissue, as a cartilage. And this will be ossified in the cartilages, membranous and cartilage. Membranous almost all occurring before birth. After birth, almost all the bone process development is a cartilaginous. Then almost all bones which are there in our body, they develops in the cartilaginous. Next, membranocartilage. Some bones which starts developing in the membranous, partly membranous, and partly we have the cartilage. Both their processes follow. Such condition we call as a clavicle and mandible are the example. These two bones which are the example for the membranocartilaginous, partly membranous and partly cartilaginous. So this is according to the classification of developmental classification. Next we get the next type, as we have already studied this one in the skeleton. Third broad classification is we get the regional classification of bone. One thing you have to remember, region wise, we have the axis, central axis, median plane, and those we call as the axial skeleton. So definition of bone is different, definition of skeleton is different. Skeleton is a framework of the body which is made up of the bones and cartilage. And bone is a connective tissue, specialized connective tissue, which is composed of 1/3 connective tissue, 2/3 of the inorganic calcium salts, calcium phosphate and calcium carbonate. Should not be confused in this. Okay? Appendicular I have told in the first practical, in the skeleton, human skeleton study with the comparative with the other skeletons. So we have the hand by the trunk, those we call upper limb and lower limb bones. That is, it is very easy because it is already asked in the NEET and other 12th standard question, because you have dealt very properly this. Okay. Next comes about we are going to get these all we have to explain. You can see all the bones which are on the axis center. We get skull, vertebral column, sternum, ribs. All this will be the axial skeleton. So these will be bones which are forming the axial skeleton. Appendicular, where you can see the red, which is representing the lower limb, upper limb bones which you are going to get, and this will represent the appendicular type of skeleton. Okay, so this is very important, you have to remember. Then all these names I have already told you to draw the skeleton, and in that you have to find out which are the upper limb bone, lower limb bone, how they are 206 bones. Upper limb how much, lower limb how much, skull bones how much, vertebrae how much. All this you have to make, and that should come, that is the 206. That is total bones. So this is all you have to remember as you comparative side by side, axial skeleton, appendicular skeleton, that you have to remember. So this is all about according to the developmental axial skeleton. Then going to the fourth broad classification is that we are going to get that is according to the structural. I have told when anything we take in the from tissue from our body, we have to use that is first we have to see naked eye how it is appears. Then you are going to again next you are going to take the section and you are going to keep under the microscope. Then you are going to study it. Okay, so we are going to see with the naked eye, then we are going to study, then we are going to cut the section of the tissue like a bone. This bone we are going to under the microscope we are going to see. So that is macroscopic with the naked eye, microscopic under the microscope. So macro and micro you should know. When you see, you are going to see the identification of the part of the structure of the bone. We get the compact and cancellous variety. Compact is the strength of the bone. Cancellous, which appears like a sponge-like. It is not soft, but appearing the sponge-like, that is a cancellous variety. Then we have the compact variety. So that will be included in the macroscopic structures of the bone. Next, microscopic, we have all these under the microscope. We can see the lamellar, fibrous bone, dentin and cement. And we get the dentin and cement, these are the parts where we can get in the teeth, our tooth. So these are strongest part of the body, very strongest part of the tissue which is we are going to get in our body is we get cement and dentin. Dentin and cement are the hardest substance of the body. We are going hardest substance of the body is we are going to get cement, and next that dentin, they are found in our tooth. So this is very important to understand the classification as we have come across the four broad classification. So this is all about the completion of the four classifications, where you can study the according to the shape classification of the bone, according to the developmental classification of the bone. Next we have got the regional classification, then structural. These are very important four broad classification, very easy, but when we ask questions, you will be confused. We teach you simple way, you will understand like all will do. When we ask and expect from you anything from what is nematization, what is the nematic bone, what is sesamoid bone, why they are present, where they are present, what are the examples, then these are the oral questions. You must know this and in the simple format. So that is the one which is you remember. All functions, everyone is expert now because I have to told remove this whatever the one bone wherever comes there you have to add skeleton where you can add that is removed bone. So skeleton and bone there is no different functions, they are correlating each. Only word bone remove skeleton, skeleton remove bone. You have to remove that. As you know, support, it gives support to the body, and it is a very hard framework of the body. That is very important. These and this way only you have to explain the when function is asked. Not like irrelevantly you have to tell any one thing. Most important, then you can go to the less important functions, first remembering. Then you have to explain each one with your meanings. That is a very important. Bone gives shape and support. You have the support I have told, and shape and support. Bone form rigid framework. It is a rigid framework. It is not easily bending or the whatever we are going to get. Movements, it helps. Bones helps for the movement where they come together and forming the joint. Bones more than two comes together, and that we call as a joint, and that will help him for the movement. And also they provides the area for the skeletal muscle attachment. We have the different muscles, skeletal muscle, smooth muscle, cardiac muscle. But these muscles which are attaching muscles to the bones, those we call as a skeletal muscle. Bone provides surface area for the attachment of the muscles, tendon and ligament. Then protection, as you are told, all everyone, act like a protective outer coverage. Skull, brain protection. Thoracic cage is heart and lungs protection. Those all will be the important, that is the vital organs. They are kept under the covering of the bone. Very important, you have to remember that is they are the bones which are protecting the vital organs. So I have told vital organ, vital meaning important not, most important not. Without that we cannot survive. That is we call as a vital organ. Don't tell what is vital organs. Most important organs. Don't answer me. Answer few batch. But you have to remember these are the organs where without that we cannot survive. One limb is removed, we can survive. Heart is removed, we cannot survive. Brain is removed, we cannot survive. Kidney one removed, okay, one kidney is we can remove. Both removed means that is also vital. So this is very important to understand the meaning of the vital organ. Protection, which is we are going to get. Mineral storage, calcium. 97% of bone which stores the calcium and other traces of minerals, and that all will be included here. Then next you are told the blood cell formation. It contains bone marrow, and bone marrow which is a development of the RBCs takes place, and that is the formation of bone. So these all are the most important functions of bone. And you have to explain the most important one by one detail as you understood what is the meaning of protection movements, what are the things to support, rigid framework, that all you have to explain in your language, and you have to elaborate one point. First, in short, you have to remember, then you can elaborate. So this is in short, we have studied the bone definition, classification of bone, then functions of bone. This is the primary one, and this is the one which is basic one, which is before osteology we start. Osteology is the word which is the study of bones. Logy is a study branch which is a science. Study we includes. So osteo is a bone. So that we are going to get the osteology, which is you are going to get, that is the study of bones. So before bones we start osteology, you should know the basic information, basic important points relating that is a bone. So this appears simple, but when we ask different questions in twisted form, you are unable to answer. That is a very important thing you have to remember. So this is all which is we are going to study today. Definition, classification, four broad classification and function. Basic part, first part of the bone we have studied. Okay, write down.